So we're going to quickly clear the SIJ, okay? A favorite joint of Jason. If you have any questions, he is the expert on it. All right. So reason I put a pillow underneath is just kind of putting him in what we call a bit of more of an open pack position on the SIJ a little bit, so that he's not in too extended where it causes a bit of a rotation anteriorly. So what we're going to do is we're going to go along the ASIS, kind of find where the ASIS, and along the iliac crest. Take my right and left hand, and I'm going to compress or distract. What does this do?
Compress.
Distract.
Yeah. Good start.
Compressing into the ASI, so it's distracting at the SI joint.
Yeah, I mean, you'll see different sources say different things, but yeah, so I'm compressing at the ASI, so maybe compressing the structure anteriorly and stretching it posteriorly. But usually this is thought of a distraction in most sources. When you're doing this is thought of distracting the PSI, so you're kind of doing that. And what you want to do is hold it. So the SI joint, very strong. Remember in anatomy? Do you remember how strong those ligaments were around that joint? How stable that joint is? Can you please remember that? Seriously. Please remember how stable, how thick those joints are, and how stable that joint is. Because in the clinic, my God, you talk to some people and you think you're flopping around in the wind with that joint. Oh, it's going out. I stand up, oh, I'm out. And you're like, what? What are you talking about? How is that possible? All right, I literally had this one lady, when she would stand up, she would literally say, yep, I'm going out right now. Yep, it's going out. It's out. I can't help you there. Here's a psych cons. No. So you're compressing, okay? And you want to hold, you know, there's some sources saying hold for 3 minutes. Yeah, seriously. No, I don't hold for 3 minutes. And it's lucky if I hold for a minute, you know. But you want to really compress. So you really, it's pain provocative. So this movements, you're looking for pain provocation. Their pain, right? Their pain, not, ow, that hurts. Is that your pain? No, it's where you're pressing hurts. So, okay, so you need to ask that specifically.
Are you compressing medially? Are you, what direction are you putting
I'm
pressure?
going medial. Yep, exactly. Okay. Now with distraction, or I should say with compression, since that I would say most sources will say that is more of a distraction. Now you're going to do cross hands. So you're going to get on the ASIS again, a little bit more medial to the ASIS. Cross hands. So you've got to be careful. You know, this can be a little uncomfortable. So let me know if it's uncomfortable, Joseph, okay? And so what you're going to do is what I'm doing is I'm going in a posterior lateral direction. So I'm kind of going in that direction. How you doing?